Misleading information about sunscreen is all over TikTok these days. Influencers are telling people to stop using it or they'll get cancer. Some posts have racked up close to 1 million views, but as CBC's Shauna Reid shows us, these claims contradict decades of scientific evidence.
To stabilize it and make it
It's a trending topic. Online influencers taking aim at sunscreen.
Sunscreen is a scam, and here's why.
I never wore sunscreen.
These are actually more dangerous than you burning.
Mainstream sunscreens
Making claims to hundreds of thousands of viewers, it does more harm than good.
These sunscreens that are on the market today are mostly toxic, and we know that they can actually cause cancer.
But get the sun, don't get the sunscreen.
This dermatologist says that couldn't be further from the truth.
Sunscreen is one of the #1 things that helps us prevent cancer. So the thing that causes cancer, particularly skin cancer, is the sun.
Sunscreen protects skin from the sun's ultraviolet radiation. There are 2 types of products, mineral and chemical, and both work in different ways to block harmful rays from being absorbed in our skin.
But you look at the whole breadth of the data that's available, and on the whole, it shows that all these chemicals are safe, which is why they're Health Canada approved.
Quebec's Order of Chemists even released a statement saying the misinformation circulating online could endanger public health, adding these influencers generally don't have the scientific expertise to assess chemical safety.
The people who are talking to you, who are they? What's their credential? Where did they get this information from?
Is there proof?
And now a counter movement, including medical experts, are debunking these myths online.
There is no evidence showing that sunscreen ages you.
Still, at this Toronto beach, sunscreen isn't a priority for everyone.
Don't feel the need for it, especially with the chemicals that are in sunscreens.
Most days I don't put any at all.
Well, what you really want to do is protect yourself against the carcinogen that's coming from the sun's rays.
About 65% of melanoma cases, the deadliest form of skin cancer, are caused by UV radiation, but it is preventable, say experts.
Even one blistering burn as a child or a young adult doubles your risk of melanoma.
To avoid the risks, experts say use a sunscreen of SPF 30 or higher year-round, that adults apply 2 to 3 tablespoons every 2 hours, and to only take medical advice from trusted professionals. Shauna Reid, CBC News, Toronto.
Well, joining us to chat about health misinformation on social media is Dr. Karen Landman. She's a physician and senior health reporter at Vox, joining us tonight from Atlanta. Thank you for being here.
Thanks so much for having me, Travis.
Why is there this rise in the amount of misinformation related to health that we are seeing online right now?
Yeah, I think it's probably a combination of a number of things. I think over the past, century, science, especially medical science, has become increasingly complex and difficult for people who are not familiar with those fields to understand. And in addition, in the United States especially, but lots of other parts of the world, insurers and other sort of players in the medical space have really gotten in between people and their healthcare providers, which I think makes people feel really distanced from healthcare a lot, really, in many ways, really distrusting of healthcare. And that, of course, accelerated quite a bit during the pandemic. And simultaneously, just over the last decade, 15 years or so, we've seen social media rise and make it possible to circulate misinformation very, very quickly and virally. And, health misinformation is not a new thing, but it being able to spread as quickly as it does now really is. So I think there's probably other factors as well, but the combination of those 2 things I think is particularly potent.
So who particularly is susceptible to this kind of misinformation?
I think we all are. I mean, I've fallen for things in the past myself. KFF has done some research on this recently and seen that, at least in the United States, people who have not attained college degrees, Black and Hispanic folks, people who identify as Republicans, tend to be more likely to believe certain myths. These are they only tested a few myths. I think generally we are all probably susceptible in one way or another to certain health myths on the internet and shouldn't consider ourselves exempt.
Okay, so, if somebody has a cut or bruise sometimes or some kind of ailment, folks will generally go online and kind of, Google what they should do. What is the process that somebody goes through mentally when they encounter health misinformation online?
I think the first thing that happens when you encounter health misinformation is a little dinging noise goes on in the back of your head, or, it's the sound of your BS meter. And we all have one. We're just differently able at listening to it. So I think the first thing to do is when something really sets off your BS meter, notice that and pay attention to that. And then look it up somewhere else. So you can enter it into a search engine and see what other evidence valuing websites and news outlets say about it. You can look for the accuracy of news websites or science-based websites on sites like NewsGuard to sort of look for, you want really sites that prize accuracy to help you validate what you're seeing in this other space. So if you see something on TikTok, plug a couple search terms into a search engine and see what a trusted news site is saying about that. You can also ask your healthcare provider, especially if it's somebody that you trust. You can check on factcheck.org, which is a nice website that does not just health misinformation debunking, but lots of other categories of misinformation debunking. You can talk to a real live librarian. They're wonderful people. They know where to find a lot of great facts, either a university library or local library. And you can look at the websites of health clinics, like the Cleveland Clinic does a lot of great debunking. The Mayo Clinic does some, and lots of other trusted, reliable healthcare providers do great work online. So, of course, on TikTok and YouTube and all these other sites as well.
Well, do you think platforms like TikTok, like Instagram, need to do a better job in terms of policing misinformation that are on their platforms, particularly when it comes to people's health?
Absolutely. They have completely abdicated any responsibility right now for doing so. There's a lot more they could do. They could post links. When anybody searches for a certain type of misinformation, they could simply post a link to a trusted source on that same subject that flashes up with whatever the search results are. They could limit a lot of misinformation that appears on their sites using AI, which has so much capacity to do so many cool things, and yet we cannot seem to marshal that to help us reduce the amount of misinformation circulating on the sites, perhaps because we can't marshal the will to engage it to do that. So yeah, they really have really blown this, I think.
What's your biggest concern right now about this trend that we are seeing?
I think it's just extremely hard to keep up. And I think you end up with people being in a situation where they just don't know who to trust anymore. And, you have people who they find really appealing online, who they feel that they can trust, that they want to be able to trust, who are telling them something that feels right in some ways. And then you have me telling them, you can't trust those guys, but they don't know me from Adam. And then, they may have a friend who gives them some information that's kind of somewhere in the middle. I think the influx of information that we're all receiving right now is more than we are actually wired to deal with. And I just don't really see anybody throwing a great solution at this right now. And I'm worried about that.
Yeah, information overload. It is a lot to navigate, but thank you for helping us do just that, Dr. Landman. That is Dr. Karen Landman, who is a physician and senior health reporter at Vox, joining us from Atlanta.